The roadway to the fountain of youth starts at your adrenal glands. I wish it was more spectacular, but you'll soon see how amazing and important these glands really are. The adrenals are two walnut-sized glands that sit on top of your kidneys. They are best known for producing adrenaline, also called epinephrine. You normally have about 2/1,000,000th of a gram of adrenaline in your bloodstream. Under stress, the fight or flight reaction, this may increase tenfold up to a whopping 20/1,000,000th of a gram. As we discussed earlier, the tiniest bit of hormone can have a tremendous effect on your physiology. These two little powerhouses produce as much as 60% of the progesterone you need during your childbearing years. They also produce estrogen and testosterone. During and after menopause, the adrenal glands take on an even greater role in maintaining the production of this indispensable trio of hormones. The health of your adrenal glands is absolutely essential to maintaining hormone balance throughout your life. Now, to digress for a moment, I want to remind you what I said earlier. All three glands, the adrenals plus the thyroid and the pituitary glands, are major components of your endocrine system, and all are big guns in achieving overall well-being. I'm focusing on adrenal issues because usually it's the most abused of the three, the most in need of the three, and in working with clients who have limited resources, the adrenals are the first of the three we generally choose to address. The adrenals produce progesterone, estrogen, and testosterone from building blocks which they acquire through other processes within your body, something far beyond our discussion here. But if I can get a bit technical for a moment, please understand that the biochemical reactions necessary to manufacture these hormones can be changed and rerouted. Estrogen and testosterone, for example, are very similar molecules, and your body can choose to accumulate either based on your adrenal health and your overall nutrition. If your biochemistry makes an erroneous turn, progesterone can be changed into cortisol, which would lead to sleep issues and belly fat. Unhealthy adrenal glands make wrong choices that set imbalances into motion, upsetting the entire quality of your life. Hormones have become big business, and here I have to climb up on my soapbox. It is my firm opinion that the current form of hormone replacement therapy, also known as HRT, that uses standard combinations of synthetic hormones is ludicrous and potentially dangerous. Here's another mantra. Every woman is different. One size or prescription does not fit all. I'm sorry to say that even in my own profession, there are practitioners that have taken the whole out of holistic. Natural treatments, the herbs that can act as building blocks for hormones, and even the bioidentical hormones that are being touted in the marketplace are not effective if your adrenal glands are weak. And now the moment you've been waiting for. The key to the fountain of youth is to support your adrenal glands and get your hormones into the best balance for you. Sounds too simple? Sounds too medical? Not exactly what you were expecting? But it's true. You may not be crazy. There are potentially good reasons why you feel the way you do, and it may all have to do with your adrenal health. Here's what can go wrong if your hormones are out of balance. If you have low estrogen, the timing of your cycles will change. The shifting of estrogen levels can initiate hot flashes or night sweats. Low estrogen makes you feel less sensual. It causes the vaginal mucous membranes to shrink and become thinner and smoother. In other words, you will dry up. Your risk for urinary tract infections increases with low estrogen. In addition to more urinary tract infections, your urethra shrinks, which leads to bladder control issues. Isn't that fun? Plus, your boobs may shrink, thus adding to this picture of attractiveness. Low estrogen will add to wrinkle formation and loss of muscle tone. And if this is not enough, low estrogen can cause feelings of depression, crying jags, forgetfulness, more confusion, trouble remembering names or thinking of the right word, and you will lose your ability to reason. That's what can happen with low estrogen. Low progesterone can lead to more painful periods with increased cramping. Low progesterone will make you feel anxious, irritable, and your loved ones may complain that you're just a little too critical. Low progesterone can actually give you the experience similar to withdrawal from sedatives or alcohol. It can disturb your sleep, giving you sleep apnea. It can cause more aches and pains, twitches, spasms, and arthritic-type inflammation. Low progesterone will definitely cause your boobs to shrink. Not a pretty picture. Testosterone. Low levels of testosterone will leave you feeling completely uninterested in sex. It can contribute to stress incontinence and other bladder control problems. Depression is one of the major symptoms caused by low testosterone, as is loss of collagen and muscle tone in the skin. Low levels of testosterone may be partially responsible for the increased drying of the skin when postmenopausal. Low testosterone can lead to osteoporosis. And, as we discussed, both estrogen and testosterone work together to maintain and rebuild cartilage. Are you beginning to get the picture of how a hormone imbalance or a deficiency in any one of these can wreak havoc in your life? And what if, like me, you had a lack of two or even all three? We're going to shift gears and talk a little bit about hyperinsulinism, because I think it is important for you to have a working understanding of how it can profoundly affect you in the context of your overall hormone balance. I've already mentioned insulin several times, and you're well familiar with our image of Sleeping Beauty. Insulin facilitates the use of sugar by your cells, the major source of their energy. In order for your cells to use these sugar molecules, they have to be sensitive to insulin. Sensitivity in this case is good, because it's insulin that gets sugar into cells. For a multitude of reasons, your cells can become resistant to insulin, become desensitized. Your pancreas will continue to produce the same amount of insulin, but because it's not having the required effect, your body tries to compensate by producing yet more insulin. This produces hyperinsulinism, a term which means too much insulin in the blood. Why this tangent? Because many serious diseases, both pre- and post-menopause, can be caused by hyperinsulinism. Adult-onset diabetes and cancer of the breast and uterus are among these, and it is the ongoing imbalances of estrogen, progesterone, and testosterone that increase your risk for hyperinsulinism. See how these all tie together? Imbalances in these three hormones isn't just about being moody or becoming frigid. They can start a cascade of events in your body that results in serious illness, even if your lifestyle doesn't require sexuality or social interaction. It is well understood in the medical community that increased progesterone levels in pregnant women, particularly those that have a predisposition to certain blood sugar issues, is a suspect in the cause of gestational diabetes. Therefore, to follow the fad, the shotgun approach of supplementing progesterone or any hormone is not a silver bullet. As I've said before, One size does not fit all. Just throwing hormones into your system can be potentially dangerous. Okay, we've come a long way on our journey. We have just one more major hill to climb before we get to level ground. It has to do with actual hormone imbalance. That is, when hormones are out of balance relative to each other.